How do I tell if I have hypothyroidism? Are you unsure about whether or not hypothyroidism is what you're suffering from? Does your doctor tell you that your TSH levels are fine, but you still believe that you're hypothyroid? If you answered yes to any of these questions, then you're in the right place because I've made this video specifically to help you start to determine if you have hypothyroidism. Hypothyroidism is most well known for its relationship to your metabolism and oftentimes weight gain or the inability to lose weight. But that's just the tip of the iceberg when you begin to look at the multitude of various hypothyroidism symptoms ranging from digestive to sensory symptoms. But also keep in mind that different people develop different symptoms. There's no one set pattern of symptoms that all hypothyroid people progress through. It all has to do with how your body responds and compensates. For example, one person may gain 30 pounds and be unable to lose it no matter what, and the next person may develop heart palpitations or chronic depression. So if you find yourself suffering from any of these symptoms, then you have to strongly consider that you very well might be hypothyroid. So I encourage you to take an active role in your health because all too often we place our health in the hands of others who don't always have our best interest in mind. So please do yourself a favor and educate yourself, or find someone who will help educate you on what's really happening with your body, as well as what the underlying cause of your health problems really is. Only then can you make an educated decision about what's best for your health. Keep in mind that most hypothyroid test options are flawed and oftentimes lead to false negative hypothyroidism diagnosis. So millions of people go untreated or are improperly treated for various other related symptoms that stem from the underlying hypothyroidism. Because of this, I often recommend what's called a therapeutic trial to confirm your own diagnosis. This is basically where you follow a proper hypothyroidism treatment protocol, including the right hypothyroidism diet, and monitor your own symptoms. And then if your hypothyroidism symptoms improve, then you can confirm that your speculation was correct. Now I'm going to cover a very comprehensive set of hypothyroid symptoms that are broken down into categories, and it's going to show you just how extensive these symptoms can be. You'll find the complete list in the description below this video. General hypothyroidism symptoms: fatigue or excessive tiredness, weight gain or inability to lose weight, obesity, excessive weight loss, cold extremities, swollen neck or goiter, loss of stamina, afternoon energy crash, low morning temperature, edema, difficulty breathing, dry or gritty eyes, slow recovery, inability to exercise, trembling, jittery or shivering feeling, hoarse voice, cold sweats, lack of coordination, heavy eyelids. The next set of symptoms is related to hair, skin, and nails. Puffiness or swelling of your eyes, face, hands, feet, or ankles. Hair loss, brittle hair, loss of eyelashes, loss of your eyebrow hair on the outer portion, brittle, flaky, or peeling nails, dry, flaky, or coarse skin, pale or yellowish skin pigment, dark circles under your eyes, orange calluses, if you bruise easily, acne, rashes, and other various skin conditions. Digestive hypothyroidism symptoms: loss of appetite, constipation, food allergies and sensitivities, difficulty swallowing, swollen tongue or ridges on the tongue, a dry mouth, alcohol intolerance, hemorrhoids, irritable bowel syndrome, abdominal distension, excessive gas, bad breath, diabetes, liver and gallbladder issues, salt cravings, sweet cravings, hypoglycemia. Here's a list of heart-related hypothyroidism symptoms: high cholesterol, high blood pressure, low blood pressure, slow or weak pulse, usually under 60 beats per minute, a fast pulse, which would be over 90 beats per minute at rest, heart palpitations, heart disease, bleeding and clotting issues. Immune-related hypothyroidism symptoms: recurring urinary tract infections, recurring upper respiratory infections, fungal or candida infections, rheumatoid arthritis, lupus, asthma, multiple sclerosis, autoimmune disease, cancer. Mental hypothyroid symptoms: panic attacks, poor memory, confusion, restlessness, mental sluggishness, ADD and ADHD, slow speech, difficulty learning new things, poor concentration, phobias, loss of motivation, lightheadedness, vertigo or dizziness, postpartum depression, epilepsy or seizures. Emotional symptoms of hypothyroidism: depression, nervousness and anxiety, easily upset, antisocial behavior, mood swings, lack of confidence, bipolar tendencies. Pain-related hypothyroidism symptoms: migraines, pressure headaches, muscle cramps, muscle spasms, back pain, wrist pain, foot pain, arthritis, joint pain or stiffness, carpal tunnel syndrome, tendinitis. Women's health-related hypothyroidism symptoms: PMS, irregular, longer, lighter, or heavier menstrual cycles, severe menstrual cramps, infertility, history of miscarriage, fibroids, loss of libido. Men's health-related hypothyroidism symptoms: So hopefully going through this list of symptoms of hypothyroidism has opened your eyes and given you a better understanding of the importance of detecting and properly treating hypothyroidism in order to properly restore and maintain your health. Most people, doctors, and healthcare professionals fail to make this connection, and far too often the underlying cause of your health problems is missed or misdiagnosed. Your thyroid is responsible for so much more than increasing your metabolism and helping you lose weight. It plays an important role in balancing and producing hormones, reducing cholesterol, reducing inflammation in your body, fighting cancer, reducing your risk of autoimmune disease, keeping your brain energized and mentally alert, and slowing the aging process. And so many of the symptoms of hypothyroidism that we just discussed can be easily avoided or eliminated when you learn how to properly restore the function and health of your thyroid. And that begins with properly educating and empowering yourself to take control of your own health. If you'd like to learn more about the safest, natural, and only way to truly overcome hypothyroidism, I'd like to invite you to a free presentation that shows you exactly what other people are already using to help them stop hypothyroidism directly at the source and take back their lives. I'll leave a link to the presentation and some other valuable resources in the description. I'd also like to invite you to please leave a comment in the description or the comments below and tell us what you're struggling with or what things have helped you along in your journey. I want to build a community here where people can use this channel, these videos, as a resource to navigate their way through the maze of hypothyroidism. Your journey, your experience, your wins, your losses, your pains, the things that you've learned along the way are so valuable not only to yourself, but to other people who may not be as far along in the journey as you are, or who haven't figured out the things that you've figured out. So if you have something that you think would benefit others, feel free to use this platform to share it. Leave your comments, leave your thoughts. Would love to just make this a hub for people to heal. So I sincerely thank you for watching. If you got value from this video, please leave a thumbs up and consider subscribing. And be sure to click one of these videos to see what's next in the series. Thank you.